I went into medicine to help people. And currently, I already have patients in my practice that are
Hmm.
struggling between, do I pay for, the staples in my household, or do I pay for my diabetes medication? Which
Okay.
one do I do? And the cuts that are coming down will make it even harder for those patients.
I am joined by Dr. Bayo Curry-Winchell, founder and CEO of Beyond Clinical Walls. Dr. Bayo, welcome to the latest word on Black News. It's so good to have you with us.
Thank you, Brittany, for having me. It is a pleasure and a joy just to be joining you and talking about all the things that are happening. So I just love your show and I'm excited to be here.
Yes, we're excited. You have been a busy bee doing a lot of things, but one of the things that we know is that you care for our people. And that's one of the best things that we love about you and why we wanted to have you on our show as well. So let's talk about something, right? We need to talk about how these things have hit our communities hard. And we're talking about whether it's Medicaid, issues with being able to get health care. America is pretty much drowning in medical debt, and it's only getting worse. So right now, 1 in 10 people owe at least $250 in medical bills. But here's what should have us all paying attention. Between now and the next 2 years, your copays and out-of-pocket costs, oh my goodness, it's already expensive, right? Could double as a result of President Trump's One Big Beautiful Bill Act. And this is happening right as we're heading into healthcare, open enrollment season. So we obviously have to be ready. So, Dr. Bayo, let's get real about what these changes mean for our families and communities. Break it down for us about what this actually means.
Exactly, Brittany. The impacts of this big beautiful bill are
Mhm.
um, covered up in actual real life what is going to happen to the everyday person. And so
Mhm.
let's break that down. The normal cost of like just going to the doctor, you have a copay, and then you may have a premium or an insurance that you also have to pay bi-monthly. Well, because the cuts that are going to be happening, what will happen is that $40 copay becomes $150. That
Mm,
premium that you are used to every couple of months, that may be 600, is now $1,200. And the budget that you are operating on, that woman who is trying to not only take care of her kids, but also pay for groceries, but pay for the light bill, where does that extra money come from? Where does that
mm,
money come from to pay for that increase in that copay and that increase in the premium? And these cuts are going to impact everybody's budget. It does not matter who you are, your budget will be impacted by these cuts.
So when you talk about, you just put it out there for us for like hitting our everyday people, our wallets, and double that cost. What type of impact will that have on these folks when they say is that keeping them from going to the doctor? If they're like, if I got to pay this much, then I'm not even going to go.
Well, let's talk about one of my patients. I'll call her Maria, who
Mhm.
is 45 years old. She has a son who is intellectually challenged, and she's also taking care of her mother who has dementia. And
Mm.
so that Maria is having a hard time. How do I even continue the care that I need to have for my son, but also take care of my mom? And these cuts will impact her ability to have health services for her son. So let's say her son gets bronchitis, a cold, anything, and needs to actually be seen by me. She's
Mhm.
now thinking, okay, well, now I have to actually pay a copay. I have to pay $35, but that $35 was supposed to go for groceries this week or go for rent. Now she is in a pickle because do I choose to spend this $35 to bring my son to the clinic to see Dr. Bio, or do I do that to keep the lights on? Or how do
Mm.
I have transportation for my mom? So those are the impacts that will not only delay care for her son or your son, anybody who's listening,
Mhm.
that's the impact.
Yeah. And just you, Dr. Bayo, you being a doctor, a Black doctor, and seeing the Marias and um, whatever other patients, right? How does that make you feel when you see this happening to them?
It is heartbreaking because I went into medicine to help people. And currently, I already have patients in my practice that are
Hmm.
struggling between, do I pay for, the staples in my household, or do I pay for my diabetes medication? Which
Okay.
one do I do? And the cuts that are coming down will make it even harder for those patients. And when we talk about preventative care, there's a lot of talk, Brittany, right now about
Yeah.
preventative care wellness. The wellness industry is booming. Well, for my patient, they're just trying to make sure that they can first provide for their family and then for their health get their medications. But if you have taken away the ability to access those medications and now they have to decide which one
Mhm.
they can do, that their overall health is actually going to get worse. We are going to see a delay in diagnosis, a delay in care where there is that 80-year-old who is all
Mm.
of a sudden having chest pain. Oh gosh, I have to pay $35 now to be seen. I'm just going to wait. I just can't
Mm.
afford it. And that's the
Right.
reality of it. And that's why my heart breaks because we want to help patients get the care that they deserve and that they need, but we're taking away those points to allow them to get the care that they need. So this big,
Hmm.
beautiful bill is nothing when it comes to that everyday person trying to get care. What it does is it takes away the access that people are just even right now trying to get.
Yeah. And I mean, you talked about delay, you talk about access, and we know specifically in the Black communities, they already face healthcare deserts. How are these changes going to impact our clinics and hospitals that are already hanging on by a thread?
That is correct. So currently, over 40% of births in the US
Hmm.
are covered by Medicaid. And a lot of people aren't aware of that. So you take away that access, that form of healthcare delivery, you have not only put mom and baby at risk, but let's go a little bit further. Now, the rural areas, which actually cover over 50% of rural healthcare services, are covered by Medicaid.
Hmm.
That means that mom and baby that I just talked about, that rural hospital has lost its funding. So that mom and baby have to travel farther to get care. And let's go back to what I mentioned.
Yeah.
More time means a delay in care. A delay in care can mean the difference between life and death for that mom and that baby. So these cuts have real implications to people's lives because there's one thing that is known in the healthcare arena, and that is time is everything, and time can make
Hmm.
the difference between life and death. And now that time has now exponentially grown where you can't get access to care. That's the difference between a person who's having chest pain getting access to not preventing, but reducing the impact of a heart attack, reducing a stroke, because we know time is everything, where that patient having life saving access of medications, and now you're having them drive 5 miles versus 1 mile because you closed their clinic because now that rural hospital doesn't have funding. That's
Hmm.
huge.
Hmm. Have you even, Dr. Bayo, like seen as a doctor and particularly working with Black patients specifically, I'm asking about, are there any diseases now that seem to be more prevalent to where knowing that if our folks can't get the care that we need because of these cuts, that is going to be very critical? Maybe there are things that we haven't even talked about that maybe our community isn't even aware of that a lot of us are suffering from.
There are, I think of diabetes,
Yeah.
hypertension, kidney disease, um, cardiovascular disease, and those diseases are instrumental to anybody living. So I always tell patients the organs that you want to make sure are
Hmm.
thriving are the brain, the heart, the
Hmm.
genitals, and the
Hmm.
kidneys. And so I just shared with you those are the top diseases that are impacting our community. So when you have those areas of health that are at the highest risk, No wonder we are passing away at the highest rate. No
Mm,
wonder we have this disparity in health conditions. And one thing that you know is near and dear to my heart is the topic of high blood pressure and how
yeah.
currently and continues to um, have treatment plans that are race based when it comes to high blood pressure. I'll give you an example.
Yeah.
Imagine you have, I'll just call this a person named Sarah. She's 35 years old. She goes into the doctor and she is told that she has high blood pressure. And that doctor decides to go ahead and put her on a high blood pressure medication. That
Hmm.
medication is chosen based on the color of Sarah's skin, and she happens to be
Mm,
black. Why do I mention that? So, there are two classes of high blood pressure medications that are currently recommended for Black patients solely based on their race. And let me give a definition. You and I know race is a social construct, meaning it's something humans made up. It is not the same as our genetics or ethnicities. Another example, just because I'm Black doesn't mean I'm African. So, right now,
mhm.
you have a medication that is two classes that are given based on someone's race.
Yeah.
Sarah comes back and she's like, my blood pressure still isn't under control. That clinician, based on what they've been told in medical school, that
Hmm.
Sarah's black, she should have two classes of medication. I'm going to give you more of that medicine or one of the others versus the five other classes that are available. Sarah comes back 3 months later. Blood pressure still isn't under control. It's actually gotten worse.
Mm,
The pipeline is when your blood pressure is not controlled, that increases your risk for kidney disease. And so now Sarah has kidney disease because her blood pressure wasn't controlled. What are we
mm,
dying at one of the highest rate? Kidney disease. But if you don't have access to all of the other blood pressure medications because your clinician is following an outdated policy and practice of prescribing two classes of high blood pressure medication solely based on the color of your skin, we are going to continue to die at a higher rate because we're not offered all of the medications. A study came out by the UCSF that said race based medication prescribing should not be happening, but it still
mm.
continues to happen. And
Um,
it's my mission to continue to share with Black people that this is happening. And the more you know when you go into that doctor, and if they decide
right.
first that you need to be on a blood pressure medication, the first thing I want you to say is, have you explored any other options? Have we explored anything else that I can do? The second
Mm,
thing, after all of that, if they give you a class of medication, either calcium channel blockers or thiazides, ask them, why did you choose this medication? You might get the answer that, well, because you're black and these medications are supposed to work best with
mm,
someone who looks like you. And I promise you, there are people like I'm sure anyone listening right now, ask your family member, are they on one of those two medications? And they were
mm.
given that medication because of the color of their skin. I will not stop. This has been, I did a TED talk
Yeah.
years ago about this, and I continue to talk about that we shouldn't be practicing medicine like this. And that is a part of the problem. When you have healthcare delivering treatments based on the color of your skin,
Mm.
it's wrong and it shouldn't be happening.
Yeah. Yeah. I mean, thank you for even sharing that because that this it just educates our people, right? Because, like, I know I've been following even your work talking about how often we are not believed whenever we go into the doctor. And so, and that's not even just depending on the color of your skin, that's anybody. But I know when it comes to us, it's probably an increase in that when we walk in the doctor's office and say, oh, this is going on with me. I know that I had fibroids and those had to be removed years ago, and so I remember for the longest, I didn't know what was going on with me either. And then obviously there is most Black women are the ones who experience that the most. So thank you for even sharing that because I hope you guys at home are going to start asking these questions. Are you on that medicine? Ask the doctor why. So thank you, Dr. Bayo. But I want to talk to you about too, as we've talked about the cuts and all of these things, what are the solutions? We've identified the problem. What are some solutions that you have as a doctor that our viewers could be doing right now?
So, if you are on Medicaid or a family member or friend or someone is on Medicaid right now, the important thing is to log any activities that you're doing, anything that you can show as far as what is part of your everyday life. Why? Because in that bill, it says that you have to now share 80 hours, I believe, of activity or work or trying to find a job. Otherwise, you will lose your services. So, starting now with logging your activities, the other thing is calling your legislator, calling and sharing your story of the impact that this will have. And I have patients who are taking care of their disabled or intellectually challenged loved one,
Yeah.
and to have a work requirement that says now you must go out and get a job. How are they supposed to continue to care for their loved one? The other thing I want to highlight is currently, Medicaid is actually one of the biggest funders for nursing homes. And
Hmm.
so, anyone listening right now, you have a family member in a nursing home, you have someone that care could go away. And that
Yeah.
means that loved one now needs to find a place to live, needs to somehow get the same services. So, sharing your story, I think, is a powerful way. Also, looking for different community resources. There are different clinics out there that have opportunities for you to maybe seek out care in a sliding scale. Of course, that's not a fix, but it's a way to continue those services.
Right.
But those are just some things that people can do, but do not stop sharing your story. I think that part is very powerful. And I wanted
Mm.
to touch on when you talked about the believe, because that part is very important to me. As you know, I have a campaign right now, and whether it's we're talking about the cuts that are happening with the big beautiful bill, or we're talking about the disparities that are happening for marginalized communities, the common thread is first not being believed how these services that could be cut will impact our community. So
Yep.
sharing your story and highlighting that this has real implications is so important. And find someone who will listen and find someone who will believe what you're telling them.
Yeah, I think that's so important because I just looked at the number of women who started sharing their stories with you and flipping through. And I said, man, it's just a number of people that are like, oh my God, like I went to the doctor and they told me it was fibromyalgia and all of these things, and it wasn't really this and that. And so we know sometimes we show up and they're like, let me just give you a medicine. Sometimes they become medicine pushers. And then you don't even know. And by the end of it, it hasn't fixed anything. Just like you mentioned, our fake patient, Sarah. And so I just appreciate you sharing that. Is there anything else that you wanted to say to the viewers before we wrap up about something they can do to protect their families or themselves as we kind of continue this wave of what's happening with this administration when it comes to healthcare?
I think because there is so much coming at us at such a rapid pace,
Yeah.
it can feel like you want to shudder and kind of like stop the noise, stop everything coming at you. But
Mm.
I encourage you to do the opposite. I encourage you to keep your eyes and ears open, because every day something could be in the news or something could be announced that could impact the the care that you have access to, not only for yourself or your loved one. And I do believe in protecting your mental health, so I don't want to say that you have to put yourself in a bad situation, but I do think there is power in knowledge and power in understanding what's happening and using
Mhm.
that information to figure out, what can I do? What can I do to somehow, whether it's, okay, I might be losing my Medicaid services, I'm going to start logging my hours. I'm going to see what I can do to hopefully protect my family. That part is huge. So my parting words, and it's something that I've always lived by and I continue, is to lean into what can you do? Lean into that positivity, because that's something no one else can take away from us. And it's something that can help you see light even when so many things are coming at you from a negative lens. So I encourage everyone to continue to remember your health is your most prized possession, and do not let anybody compromise that. And you can do that by finding different ways to navigate these challenges that are happening.
Yes, 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 yes. From your lips to God's ears, that is a locked in, sealed prayer. Dr. Bayo, thank you so much for just bringing so much joy and education to our viewers. I really appreciate your time.
Thank you, Brittany, for having me, and thank you for this opportunity to help more people. I'm truly grateful.